My name is Melissa Petty. I'm a licensed professional counselor working with Mount Rogers Community Services. I have over 13 years of experience working with mental health and substance use disorder treatment. I'd like to talk to you today about how to locate services for substance use disorder, what those services can look like, and how to talk to someone who is struggling with substance use disorder. There's a variety of different locators on the internet that you can look for to see what providers in your area can offer you for your substance use disorder treatment, as well as if they also offer mental health services. There's national locator through SAMHSA. There are also community service boards throughout Virginia. There's 40 in total. Those are defined geographically. So you have to look on the Virginia Association of Community Service Boards in order to find which CSB is in your geographical area. You can also search by private practitioners on the internet, but based on what type of intervention you would like. There's national and international websites devoted to those practices that are evidence-based, where you can find trained and certified clinicians in your area. So those practitioners who are trained in evidence-based practices such as EMDR or PCIT can vary based on where you live. But they can be found on the internet, and you can see if they are trained and certified in those evidence-based practices. You can also find psychologists through the American Psychological Association locator. So what can you expect when you seek services? You'll want to ask about the practitioner and the provider. What services do they offer? What have they been trained in? What are their certifications? What are their specialties? What can they offer you when they're helping you with your substance use disorder? You'd also want to ask about payment. So do they accept insurance? Do they do self-pay? Do they have a sliding fee scale? These are all important questions because payment and insurance can be a really big barrier to seeking treatment and getting the services that you need. You'll also want to ask about what type of specific services they have for mental health and for substance use disorder. About half of those seeking substance use treatment services also have a mental health disorder. So it's important to ask if your provider provides services for co-occurring disorders, which means a co-occurring disorder is when you have both a mental health disorder and a substance use disorder. Community services boards are one of the ways that anyone can access services in their geographical area. So what do CSBs offer? CSBs offer a variety of different services, including same-day access. So if you or someone you're assisting is looking for services, they can come to same-day access, which is similar to a walk-in clinic. Each different CSB has a designated time where individuals can come in for an assessment and an intake. During that assessment, they'll assess what your needs are, or the person that you're assisting, what their needs are, and what services they recommend. Each CSB varies on what services they offer. They may be able to help you with those services within the CSB, or they may refer you to an external provider for those services. CSBs are required to offer at least 3 main services, which is crisis services, case management, and psychiatric services or medication management. Depending on the availability of those services, they'll direct you to what services they can offer. Each CSB offers substance use block grant services. Some CSBs have a specific program for pregnant and parenting women called Project Link. There are 10 out of the 40 CSBs in Virginia that offer this program. Other CSBs, such as New River Valley Community Services, offer similar programs called special deliveries, or they may have another name for it. But you can ask what program offers services specific to pregnant and parenting women, or women who are at risk of substance use disorder. Those who are pregnant and using substances are required to receive services within 48 hours of their request. CSBs prioritize their services based on the following criteria. First, pregnant women who are using opiates or injecting any type of substance. Second, any other pregnant women who are using any other type of substance. Third, any individual who is injecting any type of substance or using any type of opioid. And then lastly, all others. Specific to Project Link, which is available in 10 out of the 40 CSBs, each CSB will differ in what their Project Link services look like, but they are designed for pregnant and parenting women who are seeking substance use treatment and may have a mental health condition as well. Project Link can offer a variety of services, including intensive outpatient, intensive case management, peer recovery services, peer recovery groups, individual transportation, individual housing resources. They can connect you to individual therapy and substance use services as well. Project Link will also do screenings based on postpartum depression, substance use, and intimate partner violence, because those are common things that happen within the context of substance use disorder treatment and pregnant women. Additionally, they may offer referrals to permanent supportive housing resources and have a contingency management program. Some Project Link programs call this contingency management program Baby Bucks or a point store, where they can earn points based on their activities of recovery and then redeem those points in order to get necessary items like hygiene products, clothing for themselves or their children, diapers, wipes, gas cards, anything that's going to help their level of functioning within their daily lives or to help make their life a little bit easier. And it reinforces their connection to their providers and helps them to keep coming back to treatment so that they don't drop out of treatment prematurely. Some Project Link programs offer children's services as well, such as parent-child interaction therapy or PCIT, developmental screenings, referral to early intervention or Part C services. They can also offer referrals to the baby care program with the Virginia Department of Health. Some Project Link programs also offer child care services, where you can have your child on site with you and also be participating in services while your child stays on site and while you stay on site. It depends on the CSB if that service is available to you or the person that you're assisting. Parent-child interaction therapy is a specific service and an intervention which is evidence-based for those who are ages 2.5 to 6 years old. The parent is basically coached by the clinician through a one-way mirror in order what to say and how to interact with their child, so that way they can learn those skills and implement those skills in the home setting. Parent-child interaction therapy can take as little as 6 sessions or more, depending on the needs of the family. Some families will not be appropriate for parent-child interaction therapy because there has to be a year of sobriety within the parent who is participating in that service. However, if you're working with a parent who has about a year of sobriety and abstinence from substances, then they may be appropriate for that service to help with that reconnection to their child. Parent-child interaction therapy can be given to those who are on an opiate replacement therapy, such as Suboxone or any other prescribed medication for their substance use treatment. That prescription does not interfere with participating in parent-child interaction therapy. Some Project Link programs will also offer services for fathers. Those services will vary depending on the CSB. It's important to ask if they offer services for fathers or partners where they can also receive case management, parenting, individual therapy, or even participate in parent-child interaction therapy themselves. Some fathers or partners will also do intensive outpatient treatment if they themselves also have a substance use disorder. Project Link has gotten a lot of good feedback. There's been mothers who have regained custody of their children, obtained meaningful work, they've gotten their own apartments or housing, and they've been able to maintain their recovery from substance use services and continue that recovery after graduating from the program. It's important to know how to make a connection to the CSB or to even a private provider. Making sure that you have a point of contact is really important. Make a connection with someone that works there. Ask them, what services do they provide? Who should I contact when I have questions about the person that I'm assisting? What if there comes up a situation where you need to talk about something that's happening and have a treatment team meeting? What does that look like? What is that process like? It's important to establish those kind of norms within the relationship so that way you know what to expect and the other person knows what to expect. And you can have a very rich and meaningful working relationship together. So if you know that one person in that CSB who's like your go-to person, they can really be helpful in getting your needs met and helping you to assist the individuals that you're working with. A lot of the community service boards will have 2 different divisions. Those divisions might be adult services and youth services, but each CSB will look differently in how it's structured. It's important to know who your contact is at each CSB for adult services and for child services, as they might be two different contacts that you might have to work with. The CSB will use what's called as an ASAM criteria in order to determine what level of care the individual needs to meet the service needs that are presenting in the assessment. The ASAM is a standardized assessment used nationwide, and it has a varying different levels from 1.0 for outpatient services or case management to 1 or 2.1 for intensive outpatient services, which is a higher level of care for those with substance use disorders. Intensive outpatient includes 3 hours per day for at least 3 days a week, but it may be more than that, and it's specific to substance use treatment. It can look a lot of different ways based on the CSB. You can also access ASAM level services in the community. The best resource for that would be the SAMHSA directory that we talked about at the beginning. The SAMHSA directory can point you to community or private providers that also accept Medicaid and provide ASAM level services for substance use disorder treatment. It's important when working with someone with a substance use disorder that you know a little bit about the brain and how substances affect the brain. When someone is using a substance, it's affecting their reward centers in their brain. If you're in recovery from a substance, it may take about 6 months to a year for you to, or sometimes even over a year, to have those reward centers to be reactivated and working on their own without the substance. It's important that you know that it's very common for folks who are in recovery at 6 months post of their initial recovery that they may have a recurrence of use because of depression. If you can talk about that likelihood or the possibility that it might happen, it can really destigmatize the occurrence of depression if the person has never experienced it before, and help them to know that they need to reach out to you or to their provider for more support during that time. If we can normalize depression and normalize these recurrences of use and the possibility of them, then we can make it so that the person will be more likely to reach out to support to us or to their provider in the future. When working with someone with a substance use disorder, it's important that you know about SBIRT, which is screening, brief intervention, and referral to treatment. SBIRT helps by having 3 different levels in which you are screening for a substance use disorder or the possibility of it, determining if they are at high or moderate or low risk of having a substance use disorder. And if they're in the moderate or high risk, then you'll want to do what's called a brief intervention. The brief intervention is using motivational interviewing techniques in order to help the person establish what's going on and if they do have a desire to change, and then making a plan of change. In referral to treatment, you are helping that person be connected to different services. We're going to go through each of those 3 main methods of helping someone through the screening, the brief intervention, and the referral to treatment. When you're doing a screening for SBIRT, you want to do universal screening. You want to normalize the questions and normalize the screening as much as you can. Some of the language that you might use to make that normalized would be, we do this for everybody who comes through our doors. We just want to make sure that we're not missing anyone who might slip through the cracks. We want to make sure that we keep everyone healthy, and part of health is knowing how much you're using alcohol, tobacco, or drugs. You also want to screen people universally because the use of alcohol, drugs, and tobacco are very common. It depends on their functioning, it depends on their use, whether or not that's interfering their ability to parent and their functioning in their daily life, and whether it is a problem. Drinking and using drugs can increase other health problems, increase risk factors, and have other issues such as legal consequences and social consequences. Without the screening, sometimes drinking and drug use can go undetected. So it's important that each person who touches someone's life, such as in the human services or in the health or medical field, to screen for substance use disorders. It can be surprising that more people than you imagine or expect do use substances in our culture. Strategies for successful screening include introducing the questions. Like I said, normalizing, destigmatizing the questions that are being asked. The more that we ask it, the more that we get comfortable with asking. Stick to the questions that are worded on the screening that you're using, and then explore each of the substances with them that they endorse have been used. Some people use more than one substance, and it's also important through that entire screening process that you maintain a non-judgmental attitude. making sure that you are checking in with yourself to know if you have any bias or stigma related to substance use, because sometimes those biases and stigmas can come across in how we talk to someone else. So it's important to examine the language that you're using and how you feel about substances. After you've completed the screening, then it's time to move on to the brief intervention. The brief intervention is meant to educate the individual about their level of substance use and also what a safe level of substance use looks like. Increase the patient's awareness of the consequences of substance use and motivate the patient toward changing their substance use behavior. And lastly, assist the patient in making choices that reduce their use of substances and also the risk associated with that substance use. A lot of the times it's helpful to use language that's giving it a specific time frame, such as how often in the last month, how often in the last 2 weeks, how often in the last week, when asking about substance use. Using those time frames can really help determine how much they're using and then if that use is a problem or affecting their daily life. When you're conducting the brief intervention portion of the SBIRT model, it's important that you keep in mind OARS, which stands for open-ended questions, affirmations, reflections, and summaries. Open-ended questions sound like, what about, or tell me about, or how about, or please describe. Those kind of questions are open-ended. They can go in any different direction and which the person wants to answer. You want to avoid closed-ended questions like, do you think, or some yes or no question. We don't want to get into that because then it limits them to say no very quickly without providing any additional details. You want to ask those open-ended questions to get more details about what the individual's life is like and their substance use. You also want to use affirmations. So affirmations are pointing out the positives about the individual. You want to focus on giving their credit to prior achievements, accomplishments, and success. For example, if you have someone who's being very honest about what they're using and how often they use, you'll want to give them credit for that. Praise them for their honesty, thank them for and appreciate them for what they're bringing to the table. That will facilitate you having a better relationship with that person, and it will encourage them to continue to be honest with you in the future. Reflections. This is one of the most important skills in motivational interviewing. Reflections are telling the person that you're actually listening to them by giving them a short, brief sentence about what they just said. And it's also making sure that you're hearing the person correctly. So if you are giving them a reflection, they can say, well, I didn't actually mean it like that. Or they might say, yes, that's exactly what I mean. And they can tell that you're listening. And that also helps facilitate a very good relationship and a conversation. Lastly is summaries. Summaries are a much longer reflection or even statements used by the individual that you're working with or assisting. So you want to give a summary at the end to make sure that you have a very good understanding about what they are telling you. So you use those 4 main motivational interviewing strategies of the OARS to then ask more questions and start the brief negotiated interview. So the brief negotiated interview is a way that you're going to engage, focus, evoke, and plan. We're going to go through each one of those phases. So you'll want to engage. So this entire process of using your OARS, you're engaging the person, you're building rapport. You're helping that relationship so that they're more honest with you and you can really talk about what's going on. When you're engaging, it's important to ask the question and raise the subject. You'll refer back to that screening process and say, I notice on the screening that you said that you use alcohol or drugs, and I would like to talk to you about that today. Once you get into that, raising the subject with them, then you'll want to focus and explore. So tell me a little bit about the pros of using the substances. What are the good things that you've noticed when you use them? That question can be a little bit surprising to people that you work with because they're not used to being asked about what are the good things about their substance use. So you might be a little bit surprised to hear the answers of what they say. Next, you'll want to ask, what are some of the cons of their use? If you're working with someone who's had legal or child custody issues because of their use, it'll be very easy for them to point out what the negative consequences have been. However, you may also be surprised that some people won't necessarily see those negatives. They may start to feel like they are blaming others for their use or blaming other systems for what's happening. It's important that you take that step back and still validate how hard it must be for them to be going through this and be struggling with their substance use. Make sure that you evoke. You want to start asking them about their readiness for change. Usually that looks like asking them on a scale from 1 to 10 about how ready they are to change. 1 being not ready at all, and 10 being very ready to change. After you've done the readiness ruler and you know that there are where they fall on that ruler from 1 to 10, then you'll want to look at asking them about their specific answer. So for example, if they said that they're a 4, what made them not choose a 3? And that can really be a conversation to explore why they think that they're further along on that. And then you'll want to ask them what makes them, or what could make them more ready to be a 5 on that scale rather than the 4 of where they're at currently. From there, you'll want to ask them, what are their supports in their life that can help them get to that 5 or a higher number on the scale to be ready? What does that look like in action? What services do they need? What do their providers need to do to help them? And what would be some of the red flags that they would need to look for to know that they would need extra support? Usually the process of the brief negotiated interview will take about 5 to 10 minutes. It's not a long conversation, which is helpful, but it's also important that while you're having that conversation, that you're continually using those motivational interviewing skills and practicing the ORs. When you're talking about referral to treatment, it's important that you know the psychosocial treatments that work. So SAMHSA has defined a lot of different treatments that are effective for substance use disorder, including motivational interviewing, motivational enhancement therapy, cognitive behavioral therapy, and contingency management, with contingency management showing a lot of more promising results than the others. But there's also a lot of support to be found in 12-step facilitation therapies or 12-step facilitation groups in the community. There's also community reinforcement therapy, instructional family and couples family that can be effective in helping with substance use disorder treatment. When you've already done the screening and the brief intervention, the next is the referral to treatment. When you're referring to treatment, make sure that you're highlighting the necessity to have a provider with that treatment. You'll want to describe the treatment options based on the services that you know of and ask for permission to facilitate that referral to the treatment provider. When you're asking for that permission, it's also a good idea to have that person give you permission to call that provider right then and there. You help with that provider on the phone, getting the information with the individual right there with you. So you both hear the same information and you can support them in that process if they run into any barriers or problems in getting that referral. The warmer the handoff, the better the outcome. So it's really important to make sure that you have that good relationship with the person that you're providing or referring to treatment, and make sure that you can give a little bit of information about who you are referring that individual to. So if you know the individual, it could be say, I know this person is really kind and really wants to help a lot of people. Or it could also be helpful to say, they have got tons of experience and I've seen how they've helped other people. This can give the person that you're working with that personal connection to that person that they haven't even met yet, and know that you're invested in helping them. There's also a lot of research that says the warmer the handoff, the more successful that person is with receiving services. So if you can help guide that process, that is excellent. And it's important to keep encouraging them to making sure that they're following up after they left your office. There's a lot of research that says if there's more than 14 days between their referral and the intake, there's less successful outcomes with treatment. The sooner someone can get into treatment, when they say yes, the better. It results in better outcomes for the individual and better treatment. It's important to also explain how the care is going to be coordinated after you referred that person to treatment. So what is that going to look like? Are you going to follow up with the provider once a month, once a week? Are you going to have regular contact or regular treatment team meetings that includes the individual? It's important to have conversations around what that looks like so the individual you're working with knows what to expect and the provider knows what to expect. With those clear communication skills and using a lot of those ORs, you can facilitate a very healthy ongoing relationship with the person that you're working with. To the extent possible, make sure that your provider that you're referring to is competent to practice in different cultural, ethnic, linguistic, gender, and sexual identity, and in order to serve that recovery process. So making sure that the CSB is equipped to provide services to a variety of different people, such as sliding scale, self-pay, the uninsured, the underinsured, and those with insurance. Have that conversation when you're making that referral, as ability to pay is one of the biggest barriers to treatment. Another barrier is transportation. Talking with that person about how that they're going to get there. Do they need assistance with transportation? Is it something that you're going to help them with, something that the community is going to help them with, or something that the CSB might help them with? But access to transportation and the ability to pay for services are the two main barriers for individuals receiving substance use treatment. It's also important to know that if you're working with a pregnant or parenting woman and they need a higher level of care, such as residential treatment, that more women are more likely to enter treatment, graduate from that treatment, and maintain their recovery after treatment when they have their children with them during that treatment. Thank you so much for listening to this important topic. As you know, children are all of our futures. This is so important, and we know how substance use impacts our life. Almost every single one of us can think of someone we know who's been impacted to substance use. So this isn't just an us versus them issue. This is an all of us and all of our communities issue. And we all need to be informed and know how to help those in need.